Remember, discernment means that you can recognize when you are making choices from a place of fear versus when you are making a choice from a place of inner confidence and trust. We are going to learn how to build our capacity to understand different sensations in the body that are helping communicate. Do I feel safe or do I feel nervous? And then being able to articulate that so that we can make your external environment as safe as possible. There is a general guideline I give to my doula clients, and you can take it or leave it if it resonates with you. But that is to stay off Google and to stay off social media. I know. It's really hard. It's really tempting. There's so much information out there. But I'm really going to invite you to be very, very particular about who you allow in energetically while you're pregnant. Google is often a place that makes people very nervous. It is not a tool to be used to self-diagnose. Everyone claims to be an expert on social media, and you are the expert, and you've also hired either a midwife or a doctor or a doula to team up with you in order for you to have a good experience. So try to stay off social media as much as possible, or monitor your usage, and maybe enlist your partner to support you in disengaging with social media. Next, I want to talk about nutrition. Did you know that obstetricians do not take even a single semester of nutrition when they are in medical school? Midwives are different. They learn about nutrition, the importance of nutrition, and so I think that it is worth talking about nutrition so that you understand what nutrients really can help grow your baby. The first essential nutrient in prenatal nutrition is healthy fat, because that is what is growing your baby's brain. It's neurological development. Super important. And most American women don't consume enough healthy fat. You can get healthy fat from full fat dairy, animal products, butter, ghee. Those are really easy to get into meals. The next important nutrient is protein. Protein is what grows your baby's organs. Prenatal nutritionists, they keep increasing the amount of protein that a pregnant person should consume during pregnancy. The general recommendation is between 100 and 150 grams of protein a day. That's a lot. You kind of have to be deliberate about it. And a lot of my clients end up using a protein powder to kind of help meet that requirement. It doesn't have to be through animal products, although that is a very easy way to meet your mark. And if you don't hit these marks, it's okay. This is just a guide. This is not about obsessing over what you should eat every day. That's not the goal here. All the micro decisions you make daily contribute to your entire experience of labor and birth. Another important nutrient is omega-3 fatty acids. You can easily receive this from certain fish like cod, anchovies, sardines, salmon, tuna, but many people are concerned about mercury and toxicity in these fish. So taking a really clean supplement of omega-3s, single ingredient, can be just as helpful and supportive. Omega-3s help with balancing your hormones in pregnancy and also prevent preeclampsia. There's also some known effects in terms of preventing postpartum depression as well. Another great supplement you can consume is a prenatal vitamin. Not everyone takes a prenatal vitamin because they might be consuming the vitamins and nutrients through their food, but certainly a high quality prenatal supplement can be very supportive for fetal development and for mom's hormone production, and also for preventing postpartum mood disorders. Electrolytes, also really helpful in pregnancy and in labor and in postpartum. I recommend choosing an electrolyte that does not have added sugar. Another essential nutrient for prenatal nutrition is choline, which plays a role in your baby's brain development, including your baby's memory and thinking. You can get this best by eating eggs, beef, chicken, cod, kidney beans, and Brussels sprouts, but I'm sure there are other amazing foods that have choline in it as well. I'm going to rattle through a couple of essential nutrients that is important for prenatal nutrition, and if you want to do further research, you can. Methylated folate, magnesium, B12, a probiotic, which will help with building gut health and a good flora for your baby, an iron supplement such as Floradix, which will essentially not make you be constipated because a lot of iron supplements have that effect, but that supports in building your blood. There's also homeopathic remedies, which a lot of people don't understand, but I encourage you to do some research and see if they could be right for you. They're certainly supportive. They're readily available at so many supermarkets, and some are particularly important for pregnancy and labor. I can't talk about nutrition without also talking about herbs. There are herbs that have been used for centuries to help with women that are pregnant. The first one being red raspberry leaf. I'm sure many of you are familiar with it, but it prepares and supports the uterus for labor and birth. Alfalfa tea or tablets cleanses the blood, promotes blood clotting, which essentially means you're less likely to hemorrhage during birth. Careful with dates. A lot of people eat dates, assuming that that will really help with how labor starts and getting someone to go into labor, but they have a lot of sugar in them. We will talk later about helpful things to try to encourage labor to start. But the reality is, if your body's not ready, it's not ready. And the most important thing we can talk about is that relaxation and trust the unfolding of labor and birth. Hospitals sometimes have food restrictions. Again, there's an element of liability here. They don't want to be sued if, you throw up and you aspirate in some way. Your provider might have strong opinions about certain foods that you should avoid in pregnancy. What's really interesting is that every country has different guidelines, and some countries eat raw fish throughout pregnancy and everything's fine. For example, the US, a lot of doctors are very scared of raw fish and tell you don't consume raw fish. So using your discernment, I do want to talk about caffeine for a second. Caffeine is okay for some pregnant people. They can totally tolerate it. They're still able to relax and feel calm, and other people are very sensitive to caffeine. So if you're someone that likes to have a little bit of caffeine, just pay attention. Does your body feel anxious after you drink caffeine? Does it make you a little stressed out? If so, then that might be your indication to cut back on caffeine. There really is a lot to say about prenatal nutrition, and one thing I will say is that it is political, and that in the United States, we are a country that really has a lot of restrictions, and again, bringing it back into the liability and the defensive medicine and not wanting to be sued if anything goes wrong. And this is the thing, like, pregnancy and birth is inherently risky. You can't remove any and all risk, but as a pregnant person, you can operate in a mode that makes you feel safe, calm, and confident. There's a lot of fear around what you should or shouldn't consume. And again, if you go to other countries, there's just not as many restrictions. Next up is a topic I feel really passionate about. It doesn't get a lot of airtime with many people that teach childbirth education. it is dental care. Why does dental care matter when you're pregnant? Oral health in pregnancy is not just important for maternal health, but it is intrinsically valuable to your developing baby. Between 14 and 54% of pregnant women suffer from periodontal disease. Essentially, it is a disease, otherwise known as gum disease, when your gums start to bleed. It is a threat for birth outcomes such as preterm labor, low birth weight, gestational diabetes, and even preeclampsia. So try and get at least one dental cleaning while you're pregnant. I would recommend 2. Make sure you're flossing. Keep up with flossing. You might notice because you are pregnant that your gums might bleed even more than usual. Just keep flossing, but be gentle. There are some ways that you can organize your life, set yourself up for success if you start thinking about this now while you're pregnant. The first one is your registry. This shouldn't be news to you. Most people have a baby registry where they tell friends and family to help them purchase items to support them and their new baby. But there might be some other things that you can add to your registry that you might not have considered. The first one is housekeeping. After you have your baby, you're not going to feel like cleaning, and your partner is not going to feel like cleaning. And to take the pressure and the burden off keeping your home clean, it might be nice to outsource that to a housekeeper or a cleaning service. They don't have to come every day, but maybe the second or third week post-delivery, you have someone come for a couple of hours. This can be really supportive to a new mother. Another thing that you might want to consider on your registry is putting in some sort of school or childcare fund. This would be just a general fund that people can contribute as much or as little as they want that will help you allocate money towards putting your child in daycare, which is not cheap in the US. So it's a bigger expense than most people think. So that could be really supportive in your registry. Another thing that you can ask in your registry is for doula care or to hire a doula. This could be another general fund that people can contribute as much or as little to that will help you pay for a doula. You can also pay for a doula using a health savings account. So I think that that is worth mentioning. And I know that there are some employers that offer fertility benefits, and a doula is considered a fertility benefit. So definitely check with your employer as well. Other supportive things to consider would be a postpartum meal service. It doesn't need to be fancy. You can even have friends or family contribute and make nice home-cooked meals and drop them off on different nights. There's also Meal Train. You can look it up online. It's a great way to organize deliveries of your favorite restaurants, or again, having friends prepare meals and drop them off to you. They basically pick a night that they want to deliver a meal to you, and it's really, really nice, especially in those early days postpartum. You can also batch cook meals and just store them in your freezer, and after the baby is born, you just de-thaw them, heat them up, and you're good to go. Definitely think about food in postpartum, especially for those first couple of weeks, because you are not going to want to cook. Another thing to think about in terms of your home environment is setting up a feeding station. This station can follow you around your home. I tell all of my clients either get a basket or a rolling cart, and you're going to put everything in that area: diaper cream, nipple cream, water for you, snacks for you, a phone charger, or a pen and paper if you're a little more analog. Maybe you have your breast pump near you. Certainly some bottles and formula if you're planning to bottle feed or formula feed. All of the essentials so that it's easy for you to carry that around your home or wheel it around the home. It can be mobile with you. Now, a lot of people get really concerned about sleep, and rightly so, because our culture really scares people and makes you feel like you're never going to sleep again. And you will, but the first couple of weeks are a little touch and go. And some people want to hire a night nurse, or some people want to hire a postpartum doula that works nights. I think it's important to know the difference between a night nurse and a night doula. Night nurses are called nurses, but they often are not certified nurses, meaning they don't have a degree in nursing. There are some that do, and if that really matters to you, you need to make sure that when you're interviewing a night nurse, you ask them what credentials they hold. If they are indeed a certified nurse, they're going to be pretty expensive, but they might have a lot of training in working with newborns. They might also be NRP certified, which is Neonatal Resuscitation Program certified. And that might feel really supportive to you as a new parent, knowing that they have these extra certifications to help with your newborn. Night nurses have a different philosophy in caring for your newborn than a doula does. A night nurse is super focused on your newborn. When the baby wakes up, they come and take your baby and they disappear with your baby in another room in order to allow you to sleep. If your baby is sleeping, then they might be next to your baby hanging out. Some night nurses or night doulas might also be sleeping. So you need to figure out, if you're going to hire someone to support you at night, do you want them to be awake with your baby, or are you okay if they're resting while your baby is resting too? This is kind of a hot topic with clients. So figure out what matters to you. Night nurses can have conflicting viewpoints on breastfeeding than postpartum doulas. What I mean by that is they are more comfortable and more inclined for the mom to bottle feed their baby, because it makes it easier on them to just take the baby and go into a different room to allow you to sleep. So if your goal is to breastfeed, you really need to think about what kind of support person can help you accomplish that. A lot of night nurses are not really skilled in breastfeeding support. So that is something worth asking your night nurse. And maybe say, out of all the parents that you support, how many of them successfully breastfeed and how many of them end up bottle feeding? Because again, if you want to breastfeed, you want to have a support person there that's going to allow you to do that. A postpartum doula has a very different philosophy. They are looking at the whole family unit. They are trying to support the mom with breastfeeding, the partner with getting nourished, any siblings, any pets. They're looking at the full family unit to see what is needed to support them in those early days postpartum. If they're working nights, they can be supportive with breastfeeding and help a mom troubleshoot. They're not just going to whisk the baby away. And by the way, that's the thing about having night support. If you're planning to breastfeed, you're going to be awake. So you have to figure out what time of day or night is going to be helpful to you to get the most rest. And it might not be all at night, and that could be okay too. Another thing you need to think about in terms of life organization is finding a pediatrician. At the end of this module, you will find some supplemental tools and information, and you will find a document that outlines questions you should ask pediatricians in order for you to gauge what kind of support your baby might receive in that doctor's care. There is emotional preparation that I think is often missed in preparing for your baby's arrival. The first one is therapy. I highly recommend going to therapy, either solo, but even better if you can go with your partner. I would say therapy is essential for anyone that has experienced any type of abuse, sexual, physical, emotional. Please find someone that you can trust, that you feel comfortable with, to help you feel comfortable in your body through labor and birth. Affirmations can also be really helpful to prepare for labor and birth. You can write affirmations with your birth partner. And it's funny, a lot of doulas, a lot of educators in the birth world sometimes put down affirmations like they're not that helpful, but I've actually seen them to be very helpful, especially during labor. When you write out birth affirmations with your partner, you're essentially giving your partner like a pre-approved list of things that they can say to you that will make you feel seen, heard, held, supported. There's also an exercise I like suggesting, which is a fear release exercise. Essentially, when you start to feel sensations in your body, like heart racing, sweaty palms, tension in your belly or in your bottom, you write out the things that make you scared or the things that are making you feel anxious or stressed. I'm worried about money. I'm worried I'm not going to do this. I'm worried about how much our life is going to change. I'm worried about our sexual intimacy. I'm worried about the changes of my body and not feeling like myself after I give birth. Write them all out. Give them to your partner and say, I'd like you to hold on to these. I want you to hold these fears for me. You don't need to do anything with them, but I'm handing them to you and I'm releasing them to you. And there's something about that practice that I think helps people feel a little bit lighter going into labor and birth. I would say the most important part of the emotional preparation for labor and birth is having an open, flexible mindset, less clinging or trying to control how things unfold, more trusting of how things are going to unfurl on their own. As a birth doula, I try and discern in my clients how open and flexible they are to their birth experience, because if I sense a client is trying to cling or control too much, I get really nervous for them because there's a lot that's out of our control, and that's why this emotional prep work is so important. There's more preparation you can do with your partner that will really set you up for success. Before you have a baby, your household runs a certain way, but once your baby arrives, you really need to figure out and delegate who is going to do what. It will alleviate anxiety, tension, animosity. The things that you need to think about is all of the baby care aspects. Who will feed the baby? Who will diaper the baby? Who will wear the baby and take the baby on walks? Who's going to bathe the baby? Who will swaddle the baby or calm the baby or burp the baby? Then you have to think about all the other household tasks, like who will do the laundry, who will do the meal prep, who will do the house cleaning, and do you have any pets? Who will take care of your pets? Talk about these things with your partner and come up with a system. Allow somebody to own a certain task so that it will take a little bit of the anxiety off your plate. Talking about these things before your baby arrives will really give you a good head start and allow you and your partner to connect on a deeper level. Another thing you need to discuss with your partner is where will your baby sleep? Some clients have their baby sleep in the room with them, especially as a newborn, in a little bassinet next to your bed. Other clients co-sleep with their baby. We'll talk about co-sleeping another time, but it is a very good option for many people, especially people that are not on medications that can interfere with the ability to wake up. Who will care for the baby at night? Who will care for the baby during the daytime? And then I think it's important that you talk to your partner. What is one thing that allows them to recharge? And can they do that thing at least once a week? And then you say, this is one thing that I need to do in order to feel recharged, and make sure that you do that one thing throughout the week. For example, exercise is important, especially for partners. Maybe your partner goes to the gym and for an hour a day for a couple days that first week. And then maybe conversely, the new mom gets an hour every couple of days to go by herself to a coffee shop or go to a yoga class on her own. Finally, you can ask your partner, What is a way that we can connect together at least once a week? Because now that a baby's in the picture, there's less time for you to have that connection with your partner. And it's really important that you still make time for your partner to connect. Then, of course, there's the physical preparation involved in having a baby. And it is possible to overdo it with physical preparation. So again, using discernment, you decide how much or how little you need to physically prepare for labor and birth. Walking, hiking, certainly daily movement is very important for you, your baby's position. Aim between 45 minutes to 1 hour of walking every day if you can. If you find that you are sedentary a lot, I would switch from sitting on a normal chair to a birth ball or a yoga ball, because that is better for your posture and also your baby's position in utero. A lot of my clients ask me about sleeping positions. I always say, sleep in whatever position is going to give you the most rest, obviously not your stomach, but side lying is considered the most optimal position to sleep in. But I do have some clients that sleep on their back, and that's just the only way they can sleep. I will say sometimes when moms sleep exclusively on their back, sometimes babies can get in an unfavorable birth position. Sleeping on your side with pillows wedged in between your legs is a really good way to take the pressure off of your pelvis. Working with a pelvic floor therapist prenatally can help bring awareness to your pelvic floor and help you understand the tissues, the muscles, all the ligaments that need to stretch and expand to accommodate your baby's descent. I would caution you, if you want to see a pelvic floor therapist, don't assume that it's going to make birth easier or better or faster. It doesn't necessarily do that, but it does build connection and awareness for a part of your body that you may or may not be connected to. There are clients that I recommend work with a pelvic floor therapist prenatally. Those are people that are overly active in sports, especially Pilates, yoga, dance. Anyone with a tailbone injury particularly could benefit from pelvic floor work, or horseback riders. There's a very strong connection between your pelvis and your jaw. So if I have a client that has a lot of jaw tension or clenches their teeth or clenches their jaw at night, I would recommend doing exercises to kind of soften your jaw, which is a good way that we can then access our pelvis. So that might just mean at night, 10 or 15 minutes before you go to bed, you just do some nice massage right on your jawline where your top and your bottom teeth meet. You just gently do circles into your jaw. It feels really nice. It's relaxing. It can be so nourishing to your jaw. The more relaxed the pelvis is, the easier it is for baby to come down and through the pelvis. I can't talk about physical preparation without talking about the autonomic nervous system, more specifically your parasympathetic nervous system, which only kicks in when you're resting, when you're relaxed. Your parasympathetic nervous system is responsible for some very important bodily functions, such as your heart, specifically your heartbeat and your blood pressure, your lungs, your liver, your pancreas, your spleen, your stomach, your small intestines, colon, kidney, bladder, and your sexual organs. All of these are connected to your parasympathetic nervous system. There are activities that you can do that really support your parasympathetic nervous system. Spending time in nature, playing with animals or with children, getting a massage, going to a yoga class, meditating, breath work, acupuncture, anything that allows you to really relax. This strengthens your autonomic nervous system. And even more so, helps your baby be able to come down through the pelvis because you're not holding on to tension, you're relaxed. When we talk about pain outside the context of labor and birth, there's this tendency to clam up or recoil, like, ooh, I don't want to feel pain, and I don't blame you. When we feel pain, it usually means our mobility is limited or something isn't functioning optimally, and it bums us out, right? However, when we talk about labor and birth, when you feel strong sensation, it means you're making progress. It means you're closer to meeting your baby. It is not something we should fear. In fact, many clients don't experience pain in labor because they're not internalizing it as pain. They're internalizing it as something that is strongly felt, and it is okay to strongly feel that sensation. When someone is scared or resistant to feeling strong sensation, again, there's that tendency for the body to clench up, to clam up, which prevents baby's descent and makes labor a lot longer, a lot more challenging on the birthing person. It is through feeling strong sensation that is going to allow you to meet your baby. Whether or not you experience it as pain is entirely up to you. And it's okay if you experience pain. You didn't do anything wrong. There's nothing bad about that. But I think it's worth exploring how you can feel calm and confident despite feeling very strong physical sensations.